Hi, I'm Dr. Tey Tze Tong, a gastroenterologist at Asia Digestive Associates at FARA. I manage patients with various kinds of digestive conditions as well as liver conditions. And in addition to my clinic practice, I also do endoscopy, such as gastroscopy, colonoscopy, as well as small bowel endoscopy for patients. Abdominal pain and diarrhea are common symptoms that many of us may experience throughout our lives. If it's of a short duration, such as less than a week, the cause is usually an infection that will usually resolve by itself over a period of time. However, if these symptoms are more persistent for a prolonged period of time, then that warrants further diagnosis. It is first important to find out more details, such as the exact duration of these symptoms. Has this been going on for weeks, months, or even a year? Is there other symptoms such as loss of appetite, loss of weight? Is there blood in the stools? Or is there a family history of cancer? If the answer is yes to any of these questions, then that may signify a more serious underlying condition. IBS stands for irritable bowel syndrome, and IBD stands for inflammatory bowel disease. IBS is a disorder of the movement and the function of the intestines. While it negatively impacts the patient's quality of life, there is no damage to the digestive tract, and there are also no long-term serious consequences such as cancer. In IBD, on the other hand, there is ongoing inflammation of the intestines, and this may in turn lead to the formation of ulcers. There can be narrowing of the intestines called strictures, and it also increases the risk of developing colon cancer in the future. There are two types of IBD, Crohn's disease and ulcerative colitis. Ulcerative colitis, as the name suggests, only affects the large intestine. And Crohn's disease, on the other hand, can affect any part of our digestive tract, from our mouth to the stomach to both the small and large intestine. In Singapore, IBS is much more common than IBD. It is estimated that up to 1 in every 10 people in the general population may experience IBS. IBD, on the other hand, they are estimated to be only about 3,000 to 4,000 IBD patients across Singapore. One of the useful tests to differentiate these two conditions is to do a colonoscopy. The colonoscope is a thin, flexible device used to examine the colon in detail. It can look for the presence of inflammation, ulcers, or any abnormal growth such as polyps or cancer. In IBS, the colonoscopy result tends to be normal, and compared to IBD, where there's usually evidence of inflammation seen, such as ulcers or narrowing of the intestines. During the colonoscopy, the doctor can also take biopsies, which is a small tissue sample sent to the laboratory for further testing. Other useful adjunct tests include blood tests, as well as imaging scans like CTs and MRIs. IBS can be treated with lifestyle modification, dietary changes, as well as medicines to treat the symptoms. The treatment of IBD, on the other hand, covers a very wide spectrum, ranging from very mild, gentle type of medicines, all the way to the other end of the spectrum, with more stronger forms of immunosuppression treatment. The overall goals of IBD treatment is to reduce and stop the inflammation. In summary, IBS and IBD are very different conditions, although on the surface they share similar symptoms of abdominal pain and diarrhea. A good and accurate diagnosis is the first step, and after the correct diagnosis is made, the right treatment and recommendations can be given to the patient.